everyone, and welcome to this episode of The Good Life for Nebraska Seniors. I am your host, Donna Blum, founder of Graceful Senior Transitions. And today I am joined by my cousin, and his name is Eric Marshall, and he is the founder of Seniors Choice in Lincoln. Welcome, Eric.
Hi, how you doing?
Very good. I'm so glad you could make the drive from
you
Lincoln
bet.
and join me here today.
I look forward to seeing you all every time I see you.
Oh, me too. Yeah.
Thanks.
First cousins, by the way.
Yeah.
But the purpose of this show really is to, we're dedicated to sharing helpful information, trusted resources, and having uplifting conversations, which is what we're going to do here today, Eric. All for the purpose of helping you to live a happy, healthy, and fulfilling life during your senior years. So, Eric, to kind of get us started, I think it would be helpful for our audience just to know a little bit about you and your journey towards founding Seniors Choice.
Well, I started selling insurance in 1994, so I've got a little experience there. I started in the selling life insurance, and kind of converted after a couple of years. Did a little property and casualty, did a little bit of everything, but I really enjoyed the health insurance market. And about 2006 or 7, there was a huge transition to the health insurance market, and so what I ended up finding was that there was a niche called Medicare that really needed agents to help explain how Medicare works, which plan's the right plan, all these things, especially with Medicare Advantage just coming out, prescription drug coverage just starting at that point in time. And I was fortunate enough to fall into several people helping me, getting me leads, different companies offering me help and assistance. And it just kind of bloomed. And I've been doing that ever since, all the way, 20 plus years now. So that's a little bit about my story. Grew up, born and raised in Lincoln, and grew up, wife, 3 kids, 4 dogs, and 10 cats. Let's not talk about the cats, but we breed some bigger Maine Coon cats. But anyway, that's kind of how I got into selling Medicare and getting really focused on Medicare. So.
That's great. Well, and it's so needed because, I really think it does require somebody to decode it or interpret it.
It can be very confusing because there's a lot of moving parts, a lot more moving parts now than there used to be.
Yeah.
So.
Yeah. Well, I know nothing about it. So today, I am looking forward to learning from you. But let's start off kind of at the very beginning, because I think for a lot of people, there's Medicaid and there's Medicare, and there are obviously big differences between the two. Maybe you can explain a little bit about how they're different and who qualifies for each.
Okay, well, let's start with Medicare. Medicare is a social government insurance program that was started in 1967, and it was designed to cover people that are retiring and people that were disabled for their health care. That's how Medicare works. Now, going back to Medicaid, Medicaid was designed for people that were low income, needed assistance because they either didn't have a job or they were disabled also. There's a kind of an overlap between Medicare and Medicaid when it comes to people that are needing health care and they don't have an ability to afford to pay for health care expenses. Okay, so there's the difference. Medicaid, people that don't have a lot of assets and don't have a lot of resources. Medicare, pretty much everybody. Okay, now there's 2 ways to get Medicare. One is turning 65. Okay, and you've worked all your life in the United States. You have to be a U.S. citizen, and then you qualify. Typically, the other way to get Medicare, there's actually 2 other ways, but one other way is becoming permanently disabled according to Social Security. Then you get Medicare 2 years later after the date they said you're permanently disabled. So that's another way to get Medicare. And the third way to get Medicare is being diagnosed with ALS, Lou Gehrig's disease, or kidney failure. Those two medical conditions get you Medicare also.
And do you have the 2-year waiting period with those?
No, those are immediate.
Those are immediate.
Those are
okay.
immediate.
All right. Well, that's helpful. Thank you for kind of breaking that down. So Medicare, from what I understand, has multiple parts. I've heard A, B, C, D. Can you explain what each covers in kind of simple terms and
Sure.
why it matters for seniors?
Yeah, okay. Well, there are four parts: A, B, C, and D. Now, A and B started in 1967. Okay, C and D actually started nationwide in 2006. Okay, so A, the original Medicare Part A, pays for hospitals and hospital treatments, everything done in the hospital. Okay, now that's been paid for by your taxes. So as we've been getting payroll taxes deducted, that's one of the things that it pays for. Part B, um, it pays for outpatient and doctor services. And this year, it's $202.50 for most people. Okay. So Part B pays for those things. We pay a portion of it. We don't pay it all. We pay a portion of the cost on a monthly basis when we do get Medicare. Okay. Now we have two other parts, Part C and Part D. Well, Part C is also called Medicare Advantage plans. Okay. And Part C plans take the money that's been set aside in Part A and Part B, gives it to the private insurance carrier who takes care of the Part A and the Part B, but it gives extra benefits that are typically not covered in Part A and Part B, things like dental, vision, hearing, health club memberships. And they pay based upon a contract that they have that's overseen by Medicare itself. And then we have Part D prescription drug coverage. And Part D prescription drug coverage can be made in two different ways. One way is included in a Medicare Advantage plan or a Part C plan. The other way is a standalone prescription drug plan called a Part D or a PDP plan. That's the insurance jargon for it. And that specifically focuses on prescription drugs because prior to 2006, prescription drugs were not covered by Medicare at all. Okay, so those are the four different parts. Now, why is it important for people to know? Because when you're going through the Medicare, I'm going to call it a maze, you need to probably make sure you have prescription drug coverage because there is a late enrollment or a lifetime, and it's a lifetime penalty if you don't have some form of prescription drug coverage, either a Part D drug plan or a group health insurance plan once you get Medicare age. So you want to make sure you have some form of coverage, or there is a lifetime late enrollment penalty that accrues over time until you do get prescription drug coverage.
Okay, so 65, and you want to have this in place by the time you turn 65?
Right, and so typically when you're getting close to 65, there's a couple of things that I would recommend. One is about 3 to 4 months before you turn 65, if you haven't gone to see your Social Security Administration about your retirement at that before then, you want to call and schedule a time to get together with them. Why? Because you need to enroll in Medicare Part A and Part B. Okay, it's not automatic. You have to do that. Okay, I recommend 3 to 4 months that you start making the phone call or doing it online. Okay, they say online works. I'm not sure if it does sometimes. Sometimes it reverts you back to a phone call anyways at the end of the online program. So once you call them, you'll schedule an appointment, say, hey, I need to sign up for Medicare. Okay, well, we have an appointment 3 to 4 weeks from now. So typically it takes 3 to 4 weeks for them to actually give you an appointment. And then once you get your appointment done and you sign up, 3 to 4 more weeks before you get your cards. This is why I'm telling you do about 4 months in advance, because you do have, for Medicare plans, a 7-month window around your 65th birth month in which to enroll in these plans. 3 months before, 3 months after, and the month that you turn 65. Now, the interesting thing is that you don't get Medicare on your birthday. You get Medicare on the first day of the month of your birthday, in most cases.
Okay,
Okay.
that's good to know. So you mentioned a maze, and you said that, I was just envisioning like how helpful it would be to have a guide leading you through the maze who already knows where the exit is. So
that's exactly what I
you
do.
do.
That's what I do is sit down and we go through and, because, just looking at the Medicare Advantage side of things here in Nebraska, we have 7 or 8 different companies now selling Medicare Advantage products with over 40 different plans to choose from. Which one's the right one for you? I have no idea, but we have to sit down and go through those,
Yeah.
and at least come out with a way for you to help decide what's important to you. Is dental more important? Is low co-payments more important? Is a premium an issue? Do I want to go with a Medicare supplement plan, which is a totally different thing? Supplement plans, pay after original Medicare. The nice thing about them is that you don't have to worry about whether or not the doctor's in the network or not. The downside is that they're terribly expensive.
So supplements kind of the direction I wanted to go next.
Okay.
So many seniors are confused about supplemental plans. When should someone consider a Medigap or Advantage plan, and how do they work?
They should always consider one of the two, because original Medicare only covers 80% of the bills in actuarial terms, okay? And there are limits to original Medicare, and there's no limit on the amount of money that you could spend on medical care with original Medicare. There's no limits, okay? But there are limits and protections with either Medicare supplement plans or Medicare Advantage plans. So that's one of the reasons why I tell you should always consider it, because as an example, there was a statistic that just came out here recently. I think Milliman did. I can't remember for sure, but original Medicare pays 80% of the bills, but with Medicare Advantage, they pay on average 93% of the bills. So it's a huge difference, and there's a protection or a cap as to how much you'd spend in any one year on your health care with the Medicare Advantage plans. Now, with the supplement plans, it typically picks up almost everything else, okay? The advantage of the supplement plan is you don't really have to worry too much about the expenses of going to see the doctor. All you got to worry about is the premium and the accelerated premium increases each and every year.
Okay. So for somebody that is looking for that peace of mind, they don't have to worry. They know that it's all going to be covered. There are limits in place. They have to pay extra, and they're not cheap, as you alluded to. But
the difference between like a Medicare supplement cost versus Medicare Advantage over your lifetime, the average difference in price is $4,000 a year. So if you have an extra $4,000 a year and you want total peace of mind, not having to worry, go the supplement route with original Medicare and a drug plan. If you don't have that extra $4,000, it may be more economical for you to look at a Medicare Advantage plan. Now, the nice thing about Advantage plans is each and every year you can switch plans, find a different plan, different company. You have options every year with the Advantage plans. Like I said, we have over 40 different plans. Well, every year, every single one of those plans changes.
Wow. So another reason why you need a guide.
Yep.
Just from my perspective, if I had the $4,000, peace of mind is priceless. It would seem like it would be worth it to have that,
Well, and some people look at that and say, yeah, I'd like to have the peace of mind. But when they start spending $6,000, $7,000, $8,000, $9,000 a year on premiums alone, at some point in time you have to decide, this person here is paying almost nothing, and they seem to have peace of mind. At some point in time, you have to take a look at that and say, maybe I should try something different. Or maybe there's some other plans that are out there with Medicare Advantage that you can buy for 30, 40, 50 bucks to help reduce the amount of outgo that you're looking at. So there's good and bad in both.
There's plenty of options.
Yes.
And if you try one thing, you're not locked in, you can change it the next year.
Every year you can change it. That's one of the myths that people say, well, once you have a Medicare Advantage plan, you can't go back to a supplement plan, and that's not true. Okay. Now, one of the things that supplement plans do offer in Nebraska is the first 6 months that you get Medicare, you get guarantee issues. So they don't ask any health questions initially for the first 6 months. But as your premiums increase, you might want to try and find something that's less expensive. You do have to qualify health-wise. So you have to answer all the health questions after that 6-month period of time is over. Okay. And so that's where some people with Medicare get caught up. If they get a health disease or an issue like diabetes, macular degeneration, heart disease, something like that, they're stuck with that plan regardless of what the premium is, because the other plans, when they try and go to a different plan, are not going to take you. This is why Medicare Advantage has become so popular. Now we have over 54% of the United States has a Medicare, or 55% now has a Medicare Advantage plan. They're looking for it to go to 60 to 65% by 2030.
Okay.
So.
All right. Well, we may have touched on this question a little bit already, but open enrollment can feel overwhelming for seniors. What tips do you have for making the most of this period and avoiding costly mistakes?
Well, the good news, there's some good things going on here. My suggestion is, first off, don't answer the phone because you're not supposed to be getting any phone calls. They're typically coming from overseas trying to get you to enroll in something. Okay, don't do that. Do your due diligence. Look at your Medicare guide. You can look online. You can go to a local agent that sells Medicare products, like myself, and we have meetings. There are a lot of meetings throughout the fall, and this is from October 15th to December 7th every year. And so you do some study, get an idea of, all right, which plan do I like? Which company has had? Look at their star ratings as well. Each of these plans has a star rating. If they're 4.5 or 5 stars, maybe that's the way to go because you're going to get high quality and performance. Those are some things that I would tell people to look at. Now, after you get a plan, and make sure your doctors are on the plan, and make sure your prescriptions are covered. Okay, those two things are important. Now, after you get a plan, starting in January, I call it a do-over. They call it the Medicare Advantage open enrollment period from January 1st to March 31st. You get one do-over. So if you screw up and get the wrong plan in the first, during the fall, you get one switcheroo if you have Medicare Advantage that you can switch to a different plan or a different product, etc. Or go back to original Medicare too. You could go back to original Medicare then as well. So you have Medicare's got some safeguards, and because they know that this happens, and so they want to make sure that everybody has the opportunity to get the right plan, so they get the right health care.
That's good to know.
Now, there's one thing that's coming up, or recently, it may not be on your list of questions here, but in the country, one of the things that's going to be coming up sooner is what's called value-based care with Medicare. Now, value-based care is not a fee-for-service plan like we have for most cases now, where you go see the doctor gets paid based upon how many people he sees that day. Value-based care is different, and it's only with Medicare Advantage plans, not with supplement plans, okay? But with Medicare Advantage plan, value-based care, where you sign up with an organization, and that organization then treats you, and they get paid based upon the amount of enrollees as opposed to the amount of times they see somebody. So it's a little bit different. What is the advantage of value-based care? 20% lower costs for the insurance carrier, 20 to 25% improvement in health care for the senior, is what they base it upon. Better blood, because they get more attention. The doctor pays a lot more attention per visit. It's typically, instead of a 5 or 10 minute visit to see the doctor, it's 30 to 45 minutes for each visit. They were really very intensive on the primary care side of things. So we're seeing that going to be occurring more and more as time goes by.
Yeah, that sounds like it would be definitely a huge improvement, being able to spend a bit more time with your doctor and go a little deeper.
Yeah.
Yeah.
And there are some, there are some here in Omaha. I know Archwell Health is one of the examples of a value-based care organization. And so that might be an option for you to, for somebody who's saying, hey, I don't have a primary care doctor, but I really want to look at one, you get the right Medicare Advantage plan. They have, and you can go to those types of organizations. Sometimes it really helps improve a person's care or health.
Yes, absolutely. Well, and that's kind of the goal, right?
It is.
To improve just healthier living in the golden years.
Right. Mm-hmm.
So how do prescription drugs costs factor into Medicare planning, and what can seniors do to keep these costs manageable?
Boy, I wish I knew. I would tell you, with all prescription drug programs, look at now a couple of things are going on with prescriptions. They capped how much you'd spend in any one year, okay? And for some people, right now it's $2,100 per year, okay? We have a deductible sometimes, and sometimes we don't. And then we have co-payments or co-insurance. You know, the difference between co-payment and co-insurance. Co-payment is a fixed dollar amount. Co-insurance is a percentage. So if I'm taking Eliquis and my fixed dollar amount, say, is $47, I would pay 47. If it's a percentage, let's say 24 or 25%, then I'm going to pay 25% of what the actual drug cost is. Eliquis is around $500 right now. So it'd be about $125 would be my responsibility every month if I was taking that particular medication. So that all counts towards that $2,100 limit, okay? Also, they may have a deductible. Now, the maximum deductible this year is $615. Here's a little future advance notice. It's probably going to go to $700 next year, and the out-of-pocket, the max we spend, we go from $2,100 to $2,400. That's what they're talking about. It's nothing set in stone, but it's probably where it's going to be next year. So how do they save some money? Think outside the box sometimes. I believe it or not, I've had people go to Mexico to get their drugs sometimes. I've had people order online from overseas pharmacies because they needed the medication and it was terribly expensive. Now, the nice thing recently is that they cut that limit to $2,100. It used to be $8,000. So now it's much lower. They also have what's called a prescription payment program. That's a new program that started this year. And the way it works, or last year, I guess it was, and the way it works is you call your Medicare, your prescription drug program and say, hey, I want to be on this plan. And instead of paying anything at the pharmacy, they average it out over the year. And then the insurance carrier sends you a bill every month. And so 2,100 divided by 12 is actually $175 a month. So if you are taking some very expensive medications, but you don't want to have a $2,000 bill in January, you can spread it out over the entire year. You don't have to pay anything at the pharmacy that way either. It's just the bill comes every month and you pay the total amount. So that's one way to do it.
Yeah, that seems like it would be very convenient at the pharmacy and then also help with cash flow budgeting.
Yeah, I would help with cash flow and budgeting. That's one way I guess would be helpful to try and save seniors some money.
Yeah. I would imagine too that it's important always to ask if there is a generic version of the drug.
Yeah.
The branded versions are always far more expensive.
They are.
Yeah.
Mm-hmm. Yeah. And a lot of prescription drug plans also have what's called step therapy. And know what step therapy? It means they want you to try the lower priced pharmaceutical before you get to the more expensive ones. And of course, you know, some of the more expensive ones may work a little bit better. They may not. But sometimes it pays if you're trying to save a little bit of money to ask it, can I try a generic first?
Yeah.
So.
Yeah, that makes sense.
Mm-hmm.
Okay. So we have about 3.5 minutes left. And so kind of wanted to make sure we tie this up with a nice little bow.
Okay.
For someone new to Medicare or is getting ready to turn 65 soon, what are the first steps that you recommend to ensure they choose the right coverage for their needs?
Well, the first step is to go to, believe it or not, you don't go to Medicare's website. You go to ssa.gov. You go to Social Security's website to sign up for Medicare. Okay. The second thing is to decide, you know, do I want to spend the $4,000 a year, or do I want to look at something that I can save that's also going to give me dental coverage, glasses coverage, hearing aids, a free health club membership in most cases, sometimes over-the-counter benefits like that you could get off the counter at the pharmacy, such as Band-Aids, Tylenol, ice rubbing alcohol, different things that you would normally buy at the pharmacy. So decide, all right, what's more important to me? Are those things more important? Am I going to get better value from this? And what you're going to see is most people are going to say, yeah, this is probably a better value. Let me try this to see if I'm going to save money. I would rather have people keep that money in their pocket. Okay. The big thing people just have to worry about when they do have a Medicare Advantage plan is my doctor and hospital in the network? Okay, because they need to typically stay in the network. Now, there are two kinds of network programs. One's called an HMO and one's called a PPO. The HMO simply says you need to do your doctoring in in the network. The PPO says, yeah, you could go out of network, but if you go in network, you're going to save more money. But you can go out of network with a PPO. So when you're looking at these plans, look at PPO versus HMO. Some people like the flexibility of the PPO. Some people say, well, I'm not going anywhere. I'm going to hang out right here. The HMO is just fine, and you get a little bit better benefits. So look at those two things there. Let's see.
So Eric, with regard to the networks, let's say they have a long-standing doctor and they don't want to change, but that doctor is not part of the HMO network, then they would want to look at PPO?
You'd want to either look at a different product, different carrier. I mean, we got 7 or 8 carriers, and you could usually find a doctor that's in the network. I mean, and almost all doctors have 1 or 2 networks that they are in.
So if you have a doctor and you want to stick with that doctor, find out what networks they're a part
Yeah, all you
of.
got to do is call the doctor's office and say, do you guys take, XYZ insurance company, and they can tell you, yeah, we do, or no, we don't. You can also look online. All the insurance carriers have a website that you can look online. Actually, most of the carriers have an app that you can go on your app, look into, is this doctor in the network or not. So there's a lot of different ways to find whether that doctor's in the network. And in Omaha, we're really fortunate that most of the major carriers are covering just about every doctor and hospital. So we really don't have a huge network issue like we might have maybe in Kansas City or Chicago or someplace like that.
That's good to know.
Yeah.
Well, we are actually out of time. Eric, I just want to thank you so much for coming on the show and helping to kind of simplify Medicare for our audience. I learned a lot, and I know our audience did too. I want to thank everybody for watching today, and I look forward to joining you on a future episode. Bye now.